You're in CRNA school, do you have to do shit that is not clinical on days that you are not in clinical? The answer is yes. Let me tell you what I'm doing today. The very first thing that I'm doing today is logging all of my cases that I did this week, including things like IVs, epidurals, spinals. All that stuff goes into a tracking system because we have to meet a minimum number of cases and skills to graduate. After I log all of my cases, I have a couple of classes that I'm still taking. For my program, I'm in a front-loaded program, so I already took all of the core of my didactic stuff. So for me, I'm doing boards preparation, and more specifically, I'm preparing for the C, which is our like pre-boards exam that we all have to take. And I have an Apex password protected exam that I gotta take today. I have 2 practice exams that are due before I take my password protected exam. Also just started OB. I'm doing OB 1 day a week, and I am going to practice my epidurals, muscle memory of epidurals, because it's pretty different from doing spinals. I have a class with 1 more exam and like a couple of discussion boards to do today. And then I'm going to brain dump everything that we did yesterday in OB. Mind dumping and then visualizing skills for me really helps me get skills faster. OB is a whole different world because like, oh my gosh, the patient slash mom slash pregnant person, they're there and super conscious the whole time. So me as a trainee, I have to simultaneously do all of my reading, establish trust and rapport with the pregnant person, and then also be receiving feedback at the same time. So it's so much like coaching and communication stuff. And like the pressure is higher in OB than it is in the OR, because in the OR, patient's asleep. In OB, pregnant person, very much awake. So it's really important to like know your stuff going into it, and that's a whole different world. So I'm gonna brain dump and then like rehearse and like go through things. I'm even gonna practice my like consent, going through my spiel again, because I have some tweaks I want to make and like the things I want to cover for everything. That's my day today.